How to Administer a Functional Behavior Assessment by Benjamin Bullock. What is a functional behavior assessment? This type of assessment is based on the function of a behavior. The function of a behavior answers the question of why an individual is behaving in a particular manner. An example: when a child with autism is headbanging, are they upset about something external, or are they receiving nurturing responses internally when acting on the behavior? Step 1. Collect data to determine the function. Behavior should be observed in a controlled environment in which the variable can be manipulated. It's also important to always question the variables surrounding the behavior through a descriptive assessments data collection. The objective is to identify the function of the behavior through this data collection. Example: a child is headbanging after transitions from school to the therapy center. Is the behavior occurring because the child does not want to leave, does not like the therapy center, or is the transition too overstimulating for his nervous system? Step 2. Using different types of assessments for the behavioral intervention plan. It's better to have at least 2 types of behavioral assessments. However, the pattern analysis assessment method is my preference for this child because the function I am targeting is headbanging. I feel this assessment is suitable because it looks at the overall patterns of behavior over a time frame. This analysis also shows you patterns in behavior such as times, settings, and events. Other examples of descriptive assessments are the Functional Analysis Screen Tool, otherwise known as FAST, and the Antecedent Behavioral and Consequence Chart, also known as the ABC chart. Here's an example of a functional analysis screening tool. Here is an example of an ABC analysis chart. Step 3. What is the function of the behavior? Social reinforcers. Attention-seeking behaviors and this function's gaining one's attention is the key factor. An example: shouting curse words in the classroom. Escape and avoidance. In this function, doing away with something undesirable is the key factor. An example: inducing self-harm in order not to do math work. Access to an object. In this function, gaining access to an object is the key factor. An example is running out of the classroom to use the washroom. Examples of automatic reinforcers. Pain attenuation. This function is harder to pinpoint as it is internal rather than external. It sometimes results in inflicting self-injury. An example: biting your finger because you have stomach cramps. Self-stimulation. Through this functional assessment, I concluded that this is the function because the behavior occurs internally and the child receives a release of tension by taking part in the act. The example is headbanging to regulate and discharge the sympathetic nervous system. Step 4. Matching the function with the intervention. Matching the function with the intervention can be a daunting task because a teacher can become misled by the function is taking place. Therefore, you must match the function with the correct intervention to decrease the undesirable behavior. Example: the teacher believes the student is banging their head because they are trying to gain attention. The teacher removes the student from the class, but they continue to bang their head outside of the classroom. However, the underlying factor is the student is headbanging to self-regulate the nervous system. By insufficiently matching the function with the intervention, the self-injurious behavior serves its objective for the autistic child, and the result is the undesirable behavior increases. Step 5. Finding a replacement behavior. The aim is to decrease undesirable behavior in this step. Therefore, it's imperative to replace the old behavior with the new behavior. For example, a child is banging his head because there is a need to self-regulate. If you stop the self-harming behavior without teaching a replacement, there is no opportunity for the child to diffuse his nervous system. This could lead to more complex issues in the future. If you want him to nurture himself through self-regulation, the new behavior must be taught. In a perfect scenario, the child would be given a verbal cue or point to a picture representing anxiety before the undesirable behavior commences. Immediately after the cue is given, the teacher would facilitate activities that are harmless, enjoyable, and positive reinforcers like spinning in a hammock or swing on a swing set. In this slide, we'll talk about other tips regarding preventative strategies and responsive strategies. First, preventative strategies. So the first is social stories, showing a video of the desired behavior during the transition from school to the therapy center. The second one is front-loading, directing the child as they transition from school to the therapy center happens by speaking in third person. An example is, Harold is putting his book bag away. Harold is putting on his outside shoes. Harold is going to the playground. Harold swings on the swing set. The next is responsive strategies. If all fails and the child exhibits the undesirable behavior of headbanging, regardless of the preventative measure taken, you should do the following. First and foremost, protect yourself. However, if possible, try to protect the child's head with a soft object, such as a cushion or body part, if it is not unsafe to do so. Another thing you could do is to restrain the child using techniques learned with the district's nonviolent crisis intervention training if you are not in clear danger. Step 6, gathering the data. By analyzing the data, the group collaborating will gain a deeper understanding if the behavior modification plan is working. It's also human nature to forget if the behavior is increasing or decreasing. Therefore, it's important not to be subjective in this approach by recording data immediately and keeping the information as accurate as possible. Step 6, review the data collection. A function behavior assessment is never static. Always adjust the assessment as needed, refer back to the data, and keep the plan consistent amongst all parties. And finally, collaborate with the team for advice and any suggestions.